The post-operative regimens are different type of forms. Either they are active range of motion, passive range of motion exercises, or static sprints. Now it has been indicated that early range of motion, rather active or passive, would be optimal for tendon healing. Different types of protocols are implicated for early range of motion exercises. These exercises are needed to improve, to have better range of motion, avoidance of extrinsic healing, and avoided tendon adhesions, reduce episode of flexion contracture, and better patient satisfaction. Number one is a Belfast technique. In Belfast regimen, there is extensor blocking splint. At the day 2 or day 3, the patient is advised to the fingers are flexed passively and extended by the patient. This is called Belfast technique. In Clinger technique, there are rubber bands which are attached. The patient extends actively and the flexion happens because of the strings.